If you frequent bars, terminals or marketplaces, you may have met three types of medicine hawkers. There's the enthusiastic hawker who is eager to show you how the medicine works. There's also the hawker who uses the Bible to convince you. And oh, the foreigner who cannot communicate in English or any other Ghanaian language but for what he sells.
All the thing way you go, because he be heba, inshallah, all if without him what get. The beheba I come to from Niger, my country in Niger, inshallah. Register like how?
They may seem very different, but what they have in common is the sale of medicines they claim can cure a host of ailments. That's not all.
One year, 2 years, where the vitality figure now wait in a year.
And there's more.
Asthma pressure, dear I like the phone don't venue agro.
Many medicine hawkers run their businesses in Ghanaian markets and bars terminals. The advantage is ready accessibility to the passerby or passenger.
You insult God. You say you love him, but you are lying. If you take this drug, you will never fall sick. My father grew to 97 years.
You may be thinking, do people believe all they are saying? Do they patronize their services?
I have sold these drugs for more than 5 years. People really buy from me. They also send to their relatives abroad. I get random calls from Netherlands asking me to send more.
I asked Amsterdam, hey, Globen, was Holland. I'm saying, now, Mr. Problem, I don't need your pa. Now, Safa be sending me.
The products and services these medicine hawkers render to the public are increasingly becoming a worry to health professionals.
The main goal of medicine, again, is not just to make sure you are feeling better, is to make sure you are feeling better with less side effect. You see, so we go beyond treating the cuckoo or treating the UTI. We have to make sure whatever you are taking is going to be in a specific dose and dosage that is safe for you to take, So there is accountability in medicine. You have the right to ask if something is coming up. So we want to first enhance accountability to what they are doing there. And the way we can start mechanizing is that first, the truth is, the storage is a problem because every drug has a particular condition it's being stored. And that is very important because it affects what we call the bioavailability of the drug, how the drug will work.
A bread seller confirms that she was severely dehydrated after consuming a particular drug. But instead of recognizing the harm it could have caused, she rather testified of the potency of the drug.
I suffered severe constipation. I used to spend several minutes at the loo, but when I took this drug, I felt relieved to the point of severe diarrhea and dehydration. My son rushed me to the hospital, and I was told that I should have taken just 1 pill and not 3. The drug has made me very strong.
If the consequences are this dire, then what's FDA doing about it?
When it comes to the hawking of medicines here in Ghana, I am not aware of any institution that provides any form of license or approval for the sale of medicines in transport terminals by hawking. When people then decide to justify their their trade by saying that it has been approved by Center for Plant Medicine and Research. What I want to say is that it still does not constitute a market authorization. One sure means by which you know that it has not been approved by FDA is at least the information on the package. There are times that you find them in different languages. If it's not in English or there is no PRO translation with it in the English language, that's a sure sign that it has not been approved by the FDA. Again, you look at the expiration date, the date of manufacture, and then the expiration date. And then also the batch number, because there are times where these products may have to be recalled or you may have to make some complaints about it or something. And it's the batch number that will give the lead when you have to do any such reporting.
It's obvious. The greatest responsibility lies on you. Yes, you the individual, to take up the watchdog role and ensure what you consume is wholesome. Elikim Aku Kunkpe. Joy News, Accra.